You know that you have to do guided, but you are afraid of doing guided, but you know that's the right way of doing things. You know, this is the exact picture that pictures everything. You know, so my answer to this question is this: 100% guided. You know, every stuff that we do now in the surgery and everything, it needs to be guided 100%. You know, we have the tools and everything that we need to do that. So I want to do the planning with a coffee in my hand. You know, that's the idea of doing a planning and digital everything, not fixing a mess. Usually a surgery goes like this: you do some measurements and after that you go to the patient and stop guessing there. You know, with guides you don't guess, you do the planning before the surgery and you move on. You know, to start the guided part you need 4 elements. The first one is the scan, CBCT, a software that matches everything. In our case it's Atomica AI, and the perfect kit for guided surgery that is molded. You know, the scanner has to have 5 elements. First element is precise. It needs to be fast, easy to use software because you have a lot of options and you lose everything there, but it must be easy to use. You know, photogrammetry, now it's a must because you have to do it exactly. Yes, and of course it must be cost effective, because if we have a very expensive one we won't use it. You know, the CBCT needs to be clean, of course. There are 4 stuff that you need to see in a CBCT. Okay, these are the stuff. And to have a CBCT that looks okay, there is a trick, a little trick. If you have the CBCT in your office, it's easy to do. If you have it in another place, it's a little bit hard, you know. But this is a video how to do it. You see?
Vem um pouco atrás, eles tentaram, eu eles inside, right back, e eu deixei mostrar. E vamos levar esse lugares, e eles ask the patient to try not to move it from the online.
It will remove mucosa and everything, and you have the clean preview.
And that's going to be those little birds so you up, do sit up instead of pushing against them. Just go ahead and just tuck the head down a little bit, and you can see that's going to hold the cheeks and the lips and the tongue, so there you can rest it, okay? In the upper jaw, we just need to breathe. So if you're only going to be one arch, you can see that's right. If you're only going to be one arch, you're obviously going to use hot oils and the right?
In a CBCT you can, of course, measure gingiva if you do like this. In the CBCT.
Well, now you can see everything being held alive. That sheet submitted it. I like to take it and bun them in half. And we'll step one on each side and there in that. Yes? And just repositions is this part right here, we're ready to this shit. And by being with us, you're seeing the software later, that everything is well isolated, where that you know better align the osmolar file to the information and CBCT.
You know, so we have 4 types of guides that we can use. One type of guide is tooth supported, the other is mucosa supported, bone supported, and mix supported. When we are doing sinus lift and also on implant and everything is mix supported, you know. And of course we have special guides also, Curie technique guides, even for keratinized gingiva that you can harvest from palatal. I did also a model there. Nice. Okay. So to start the guide, everything you need to start guided. Okay. You are having 5 steps to do. The bigger steps. Okay. So the first is the tissue punch, to use it flapless. That's the idea. Use it flapless. Tissue punch, initial drill. After that, the length that we want to go to, there can be more drills, you know. After that, we need to do a bigger hole. Yes, we have here from the initial to the first, go on the leg. After that, bigger hole, you know. And after that, insert the implant. So when you start guided, everything guided, I have 4 levels of knowledge, to say like this. So level 1, you need to have, of course, the CBCT intraoral scan matching. We are doing prosthetic driven implants, not implants where we have the bone and everything. It's all prosthetic driven. So you need to position the tooth, implant positioning of course. After that, we have to put the sleeve, design the guide, 3D print, do the surgery, and put the healing caps. This is for flapless, okay? The level 2, after you do some cases on level 1, the level 2, it will be tooth and mucosa, you know, and you have to put 2 implants. You do the polarization, you do the prosthetic components you put there, you add the reinforcement of a guide, because when you have an edentulous case, a terminal edentulous case, you need to reinforce the guide. After that, it will be elastic. No? Level 3, I name it Stageable. Stageable is the flapless full arch. Yes, there we gonna have a denture that is X-ray. You can see it on X-ray with the denture. You have to put the pins. After that, if you have teeth, you have to put a pin fixation guide. If not, just the guide with the pins. Digital wax up, edit everything there. You have the wax up and everything for the prosthetic, for the provisional. Okay. Intraoral cemented the temporary tubes, provisional finishing, and after that, screw and seal the access. And that's the case. A flapless all-on-X case. And if you want to go further to level 4, as the stackable, there you need to learn new things like Dicom, vertical mounts, to put the base of the stackable in the correct position, the foundation, flap elevation, bone reduction, flap release, and optional bone graft and tissue grafts, and of course complex suturing. You know, when you're doing classic, you know all the stuff, but I'm saying for the guys that are new to that, you know. So we continue with one case, immediate loading 1 implant, of course flapless. This is a combined case, not just a simple implant with a provisional. I did a socket shield also here. So that's the tooth that I cut the shield. I put the guide. I used the level implant. Of course, you say why I didn't use the rapid implant, but I wanted to see if the level is okay, and it's very okay. Okay, here you see the gap between the shield and the implant. The provisional that was done before the surgery. Remove it. Finishing. And at the patient. Ta-ta-ta. Okay, so case 2. With 2 implants, immediate loading. This is the case, classic case, lower incisors that we have to remove them. Put 2 implants. Okay, do the guide. For provisional, here I'm doing like this. I send the scan to the lab. The lab will do my wax up. After that, in the virtual extraction, we can do virtual extraction in Atomica also, but I prefer for the lab because I want it to fit perfectly with the prosthesis. Okay, so they send me back this scan. Okay, I'm doing the guide, and for the provisional, I'm cutting the guide in the middle, and I unite the guide with the provisional, and I make my provisional. That's the idea of immediate loading in this case. Okay, so case 3, Stageable. we have here, you can see the X-ray denture, how it fits on the CBCT. You know, it's perfect fit. That's the idea, because on a dentureless case you don't have nothing in common with the CBCT and the scan. You need something common there. So this is the denture. Okay, the guide with pins. Also the pins in the prosthetics, the provisional. This is the version 1 of doing this. You know, you can do like this guide, but here we couldn't do it. If you have a bigger reach, you can remove the inside of the guide and do it like a denture on the lateral and in the middle to be the prosthesis, and connect it with pins. Has more stability, but in this case this was the best we can do. Okay, this was the guide, of course with mod, the prosthesis, the provisional. Here you have to be very careful, because when you put the pins must be screwed in very careful, not to be in a way or another, you know, just on halfway, and after that easy this one, easy this one, easy this one. You have like this, you see the white gingiva, it's perfect. 40 units, temporary verification, cementing. This is the provisional, screwed in and verified. No adaptation. That's the idea. Case 4, the last one. Okay, stackable. So you have the patient, we do the extraction, we keep the tooth, the teeth that we want to rely on. Okay, so this is what we kept. We do the planning, put the implants in place and everything. After that, we did the segmentation, have the foundation guide, and then you see how much bone we have to remove. Okay, the plane of the foundation guide, it's the bone reduction guide. No, this is the vertical mouth. To have with vertical mount and foundation guide, you can put it in the perfect position, the foundation guide. Okay, after you put it in the perfect position, you put the fixation pins, reduce the bone. This is how we reduce the bone. Put the surgical guide, do everything, put the implants and all that. Provisional. Okay. And I'll show you now this is how a provisional looks. And here you use some pins to fixate every stage, you know, every stackable. Okay, and I'll show the live surgery as a little video. Okay. Yes, what to choose? That's up to you. Yesterday I said, if this was your grandmother, what you choose, you know? So I have a take-home message. Yes, freehand is guesswork, guided surgery is control, Flapless is the natural evolution. Thank you.